sir and respected Zulka sir for making my talk very clear and speaking in favor of me. So, can I have pointer? Yeah, this is the one. Yeah, thank you. So, my topic is, okay, my topic is cardiovascular kidney metabolic syndrome, understanding and management. It's a huge topic. I will be merely giving you the outline of this topic. So, I will only be giving you just a glimpse of it. So, this is a AHA scientific statement article published online on 9th of October 2023. And this is in circulation, Official Journal of American concept that this excess dysfunctional adipose tissue not only lead to hypertension, dyslipidemia, metabolic syndrome, and diabetes, rather it also potentiates inflammation, oxidative stress, insulin resistance, and valvular dysfunction. Also, it contributes to glomerular hyperfiltration, glomerular necrosis, sclerosis, tubular interstitial disease, chronic kidney disease, neurohormonal activation, plasma volume expansion, atherosclerosis, myocardial remodeling, fibrosis, cardiac dysfunction, and many more. Ectopic fat may be a local source of mediator and can produce compressive organ damage when deposited in epicardium and pericardium in the case of heart. It promotes not only coronary artery disease but Thank you, everyone. Thank you. Thank you very much, sir.